Hi everybody, Dr. Alizadeh here with another episode of Why? Was it worth it? And today we're gonna focus on the recovery edition of Why? Because that's probably the most important part after your surgery, is to really think about and visualize what your recovery is gonna be like. With a tummy tuck, what we're doing is addressing three parts. We're gonna address the skin, we're going to address the fat layer, and last but not least, we're going to be tightening the muscle layer. So if you think about stretching of the abdominal wall, where you have what's called a diastasis rectus, if things are stretching out, at some point you're gonna have enough weakness where you may actually have a hole or a hernia. Usually if we're just doing skin alone, you're really not gonna have a lot of discomfort. Most of the pain that happens when people have surgery is either related to a bony surgery or muscle pain. When you have some cuts where you have that repaired, that's something that maybe it's about 24 hours of what you're feeling. Going to the next layer, which is the liposuction for the fat, you're gonna have some soreness. A lot of times you're gonna have some shooting pains because the nerves have been banged around and pushed around, so you're gonna have some twinges and burning sensations which come and go until the nerve gets back to its normal state. That could take anywhere from a few days, and with some very, very sensitive people, it could take a few weeks. Going to the next layer is the muscle. That's the layer where you're gonna feel the most intensity. Imagine this is your diastasis that's been stretched out, and we're tightening everything. That sensation alone is something new for the brain, and the brain is trying to figure it out. We give you a bunch of things that really help expedite your recovery. We do what's called a tap block, and that's a anesthetic that goes in the layers between the muscle, and it addresses the nerves that are coming in and supplying the sensation to the abdominal wall. So by specifically putting this numbing block in that area, we're able to actually numb the entire abdomen for the first 2 to 3 days, which makes that sensation much better and actually allows you to go to that next stage of recovery.